What do you do with a lost tooth when you're too old for the tooth fairy? Good thing it's Dental Hygiene Wednesday. Hi, I'm Christina. I'm the lead hygienist here at Dublin Dental Care, and I want to welcome you to our Dental Hygiene Wednesdays. Every week we like to cover different topics or product that we use and believe in here in our office to give our viewers information on how they can keep their mouths nice and healthy. Last week we talked about whitening. We do core whitening here in our office and we get great results with it. And this month we're actually doing a promotion where you can get up to $100 off a procedure. So if you have any questions or have ever wanted to get your teeth whitened, feel free to call our office and we'll give you more information. This week we are talking about what you should do as an adult if you lose a tooth. Losing teeth can happen. Unfortunately, these aren't just stuck in our mouths and won't ever come out. Things can cause them to fall out, such as sports injuries, if you get in car accidents, or if you happen to fall and hit your mouth on something, that could cause a tooth to come out. So if that happens, what do? Can you even fix the tooth or save the tooth, or what? So I'm going to give you some information on what you can do to hopefully save that tooth so we can put it back in the mouth for you. So if you find yourself with a tooth that has fallen out, the key to remember is don't wash it off, don't try to dust the dirt off the root of the tooth. If it is out, we want you to handle it by the crown or the biting surface. So this big part right here, we want you to hold it by this part and not the root, because you can damage the root. So make sure if you're gonna pick it up, you pick it up by the crown and hold it. And there's a couple of different things you could do with it if you are coming in to have it put back in. One is, if you're able to, put it back in where it came out of, apply a little bit of pressure with like a paper towel or something and kind of just hold it down into place lightly with your upper teeth or your lower teeth, whatever, until you get into the office. That way it's keeping it in your tooth socket, and then we will evaluate. Another thing you can do is actually placing it in between your lip and your front teeth or the upper teeth to help keep it wet with your saliva. That'll help keep it nice and healthy. And the third thing you can do is put it in a cup and either put cow's milk or your own saliva in that cup and cover it with that to help keep it nice and healthy until you can get in to see the dentist. It's important if you do lose a tooth, you try to get in as soon as possible. The longer it's out of your mouth, the less likely it'll be able to be put back in and actually survive and stay healthy in your mouth. So definitely important to come in as soon as that happens, if possible. However, there are things that you can do at home to prevent this from occurring. If you play sports and you're in like a very physical type of sport like hockey or even football, basketball, anything like that, mouth guards are key. I know it can be uncomfortable, but they will help cushion and keep your teeth nice and healthy and protected. So we always recommend mouth guards for even little kids to adults to help protect those teeth. If you're driving, always wear your seatbelt to keep you from flying forward if unfortunately you get in an accident and hitting your face. And obviously people do fall, you do have accidents, so just try to be aware when you're walking. But if it does happen, hopefully you can use some of these tips I gave you today to keep your tooth healthy until you can get in to see us. If you have any questions, feel free to email me at christina@dublindentalcareohio.com, or you can even comment on our video. We always like seeing your comments and your likes, so feel free to do that. Visit our website, it's dublindentalcareohio.com. You can even schedule an appointment there. I hope you have a great week and we look forward to seeing you next week. Thank you.